Hello and welcome to the Health Wrap by the Hindu. This is, in video format, everything you can learn about health on the Hindu through its various formats. Through the Health Wrap, we aim to bring you news, analysis, views and explainers from different parts of the world and point you out to health news you can go back to and read on our website. Do not forget to watch out for our expert segment. Today it will be Dr. N. Ramkrishnan, founder, Nitra Institute of Sleep Sciences, Chennai. He was among the first few professionals to bring sleep into our waking consciousness. So today we have once again with us Zubeda Hamid, my colleague on the health desk. So Zubeda, what is it this week?
This week we had some exciting news because scientists have discovered the rarest form of blood group in the world. It's a new blood group. It's called the 48th known blood group in the world, and it is so rare that only one person in the whole world has it. It's called Gwada negative, named after a woman from Guadeloupe who is actually the only person in the world to have this particular blood group.
Yeah, so it is fascinating if you ask me. And from the point of view that biology is constantly throwing surprises at us. You know, we think we know a lot, but it's just an open field out there. We keep learning new things every day in health. And sometimes, you know, fundamental things like a new blood group.
Yes.
But talking about blood groups, we also had some really interesting information on developments in cancer care. Particularly early stage success in treating with CAR-T therapy inside the body.
Yes.
So this is likely to open up a whole new world and completely transform cancer care as it is now.
Absolutely, and it holds so much promise, especially because cancer continues to be on the rise globally and in India, and this particular therapy has shown success in treating blood cancers, and now scientists are also looking at it to see whether it can treat solid tumors like breast and lung cancers. So yes, a whole new world of promise for cancer care.
That should take us back to HIV, because we all heard about a new treatment for HIV, to prevent HIV, that the US FDA had recently approved new treatments. Do you want to talk about that?
Sure. The pharma company Gilead has now brought out a twice-a-year injection called lenacapavir. It's being called a major breakthrough because it reduces transmission risk of HIV by over 99%, making it practically a vaccine. And since HIV cures have been so elusive for so many decades now, this has come as really exciting news.
Yeah, it's again, this is part of my wow moments, because when I started covering health back in the day, the biggest health crisis was at that point of time HIV. So to come to this, 27 years later is quite a wow moment. But at the health desk we are pretty careful about access and equity of access to healthcare. So not everything that we discover or invent is available to all, and we are very conscious of that. Something as fundamental as cataract surgery. So it is learned that as far as 2023, only 17% of those with vision impairment had access to cataract therapy.
Yes, that's one of the things. It's such a very common ailment. Almost all of us will probably get it when we are maybe in our 60s or our 70s. And yet, even though the surgery is so simple, so risk-free, so it does not require very many resources at all. And yet, so many people in our country do not have access to it. And it continues to remain one of the leading causes of preventable blindness.
Right. Incidentally, this is Cataract Awareness Month, so do check out the stories we have on our website. Shall we talk about, again, treatment advances, this time for brain tumors and spine conditions?
Yes, absolutely. For spine conditions, especially minimally invasive surgery has become the norm now. And this has really transformed the way these diseases are treated, because it means obviously lesser time in hospital, which means lower costs for one thing, but also it means faster recovery, doesn't it?
Yeah, that's true. We'll have to now, also look at something that has, worried us deeply, a certain stagnation in improving maternal and child health. So that is something that also took our attention this week.
Yes.
So do you want to talk about the stories we've done on
Yes,
that?
absolutely. As much as we talk about advances in care, we must not forget that the very basics is ensuring that our mothers and our babies are doing well throughout. And that sadly isn't, we have still not reached that stage in India. We had a recent analysis show that just 4 Indian states, Uttar Pradesh, Bihar, Maharashtra and West Bengal, still account for half of the country's low birth weight babies. And we know that low birth weight means that you can have a higher risk of developing conditions later on in life. It's also linked to developmental delays. And so it's really necessary to ensure that there is an optimal birth weight that all babies are born at. On top of that, we have rising temperatures, as you know, climate change also contributing to this issue. And we do have a podcast this week exploring how extremes of temperature can really impact pregnancy outcomes.
Yeah, that's, I think it's quite appalling that, enough attention is not being paid across the world, not just in India, but across the world to the impact that heat stress or even climate change stress can have on people, not just physically, but also mental health. When we talk about maternal health, we need to obviously look, we spoke about the pregnancy aspect, but we need to look beyond. One study that we covered this week showed that children whose mothers had experienced domestic violence were more likely to suffer from depression in their teens. So that is a generational impact on the health and safety of individuals from domestic violence, something that we don't really consider in the realm of health, but has a deep impact.
Absolutely, going to show how much we need to safeguard maternal health, not just during pregnancy, but also post that as well.
And this means, in a country like India and most developing worlds, the involvement of the government sector, there has to be a solid involvement of the government sector. One interesting experiment that is happening in context is the PICME system that Tamil Nadu has. It's a digital monitoring system for pregnancies and for child health, early child health. And there was a very interesting case that we reported on in Tamil Nadu of mothers, expectant mothers coming to the health clinic, and the PICME registration has discovered that these were actually not majors, they were minors who had been married off with forged Aadhaar documents. So, it's just another way of ensuring that the rules and the laws are followed to benefit the women and the children, of course. I mean, there is definite impact on the health, childbearing capacity, etc. We know that from studies on minors, on girls who are not yet of marriageable age. So that is something that we have to look at, strengthening these registration systems for everyone, but also pregnant women and children. Talking about MMR, Kerala continues to have the lowest MMR, good for them. I think that's a robust public health system that manages to do it. And it also is an indication of very good integrated care, multi-dimensional integrated care.
Yes, just goes to show how digital tools can really help with the health and safety, especially of women in our country. But moving on, Ramya, we still have gaps at larger levels of healthcare. For instance, we had a study this week that flagged so many issues with our organ transplant system.
Yeah, lots of issues, considering that we are so many years into the organ retrieval and transplant system. It's appalling that we have as many loopholes as exist now. So we're looking at underfunding, shortage of specialized doctors, doctors with training to do transplantation, and just simply long procedural delays in getting an organ. I know it's not easy in to get an organ. It's, the opposite side of it could become organ commerce, which we've seen in this country. But when the organs are available, I think it is important for us to reduce the waiting time and the anxiety for the patients and their family members who have to undergo a transplant. So that is looking at medical transparency, and in this context, I want to inform our readers that West Bengal has introduced a new bill for medical transparency in pricing And this is trying to address the public frustration over hidden costs if you go to the private healthcare sector.
I think that is something that is sorely needed, because I'm sure all of our viewers can agree that prices in private healthcare are simply staggeringly high.
Right. You want to talk about that new genomic computing facility that was set up in India last week?
Yes, the ICMR has the Indian Council of Medical Research, that is, which is our nodal scientific body in this country, has been really trying to up its genomic abilities, its and by setting up a new computing facility in Pune. It's going to help us store data, analyze all of the data faster, and all of this is an aid of being prepared and ready if there is another pandemic that breaks out.
Yeah, preparation is key, and preparation also means very vigilant health systems that will be able to stand up and deliver if there is even any other kind of crisis or even regular delivery of health services. So we also have a bunch of other reports that went online. Zubeda, why don't you flag some for our readers?
Absolutely. If anybody wants to know anything about one disease, we have a series of explainers. This week we had something on albinism, we had something on vitiligo and breaking the myths around it, on screening for kidney cancer, which not many people have heard about, on understanding what chronic pain is and how it can be a risk factor for suicide. We also have a really interesting explainer on clinical trials. If you want to know how these happen in our country, this is for you. Hello, Dr. Ramkrishnan, and welcome to the Hindu's Health Wrap.
Hello, good to be here.
Doctor, we all know about the importance of sleep, but not many people are aware that a good quality sleep is linked to better health, and not having enough sleep can lead to a number of diseases. Can you talk to us a little about that?
It is not just a period of rest. There are a lot of changes in our hormonal levels that happen during sleep. There are a lot of changes that happen to our blood pressure during sleep. So, considering all of these, what happens is each one of us needs a certain amount of sleep every day, and that varies with age. But if we don't get enough sleep over a period of time, it can lead to several psychosocial problems and medical problems. To start with the psychosocial problems, I would just give a simple example. If you don't sleep well one night, then the next morning, when you wake up, you feel like you have a headache, you feel irritable, your eyes are red, you are unable to focus, you feel like you are not able to concentrate, your productivity comes down the next day. All of this with just lack of sleep for one night. And multiply this by several nights. People who don't get enough sleep have what we call a sleep debt. They don't get enough sleep. And over a period of time, when we accumulate the sleep debt, we are prone to developing anxiety, depression, reduced productivity, all of what I said in multifold. In addition to this, it's clearly been shown that sleep disturbances can have an effect on high blood pressure, because normally our blood pressure dips at night, and if we don't have that nocturnal dip, then your blood pressure can remain high and it can lead to hypertension. And more importantly, for those who already have hypertension, if you don't get enough sleep, you may need more and more medication. Your blood pressure may not be well controlled. Same is true for diabetes. Like sleep and diabetes are very closely linked. Diabetes can disturb sleep. If you don't get enough sleep, your diabetes may not come under control. All of these happen. Additionally, it has been shown that people who don't get enough sleep or don't get good quality sleep are at higher risk for what we call atherosclerosis, or basically like your blood vessels are getting more clogged, and therefore they are at much higher risk for heart disease and stroke.
Tell us what makes for good quality sleep, doctor. What is the actual process involved for good sleep hygiene?
So number one, I would say that like having a routine is very very important. Like having a reasonable range within a time when you sleep. Like let's say I sleep between 9:30 and 10:30 or something like that. Having a fixed time to sleep, having a fixed time to wake up is very very important. I would rate that as number one, because again, as I said, I mean, once in a while people partying or having a commitment and delaying your sleep is okay, but taking your sleep for granted and sleeping at variable times certainly will not give you a good quality of sleep. Number two, when we wake up in the morning, exposing our body to sunlight in the morning has an impact on the quality of sleep in the night. And that's because of the circulating what we call melatonin levels in the morning. When our body exposes to sunlight, the vitamin D level goes up. In the night, when we expose our body to darkness, the melatonin level goes up. And so this cycle is very important for us to get a good quality of sleep. Often people ask me, can I walk in the evening or get sunlight exposure in the evening? But the morning sunlight is what helps for sleep much better. Next, eating on time, and that's becoming very interesting phenomena that we see, the midnight biryanis and 2 a.m. eating and all of those is getting very, very common in cities like Chennai. I'm sure it's happening everywhere. And we always tell people that you should eat on time, whether it is breakfast or lunch, but most importantly, the dinner. The dinner should be at least 2 to 3 hours before bedtime so that you digest well. You're not going to bed with a full stomach. Your risk of getting what we call acid reflux and all is much lesser, and you get a much better quality of sleep. Next, stimulants like caffeine, smoking, alcohol, all of these will impact sleep. Although sometimes people will say, oh, I can drink caffeine before bedtime and I can sleep perfectly well. Not true. The quality of sleep is definitely affected by all of these. So we say that you should avoid these stimulants at least about 4 to 5 hours before bedtime, is what we normally recommend. Next, some kind of unwinding before you sleep. Like today, our lifestyle is like very fast paced. We go to work, you come back, you hardly get time for, family or anything to do. But that certainly affects your sleep, because if your mind is busy and you're just like, after a busy day, just trying to go and sleep, you may sleep, but the quality may not be the best. But some kind of unwinding, and when I say unwinding, it doesn't have to be meditation. It can be anything that you enjoy. It can be sitting with a book, it can be listening to some music, it can be just talking to the family or playing a little game. Any of those, some unwinding of the mind definitely helps, uh, you know, better quality of sleep. And also avoiding gadgets at night, like exposing to light all the way till bedtime will certainly impact the quality of sleep. And this is a big challenge these days, right from adolescents to older adults, each one of them for a different reason. Like children do it for a different reason. Most older adults are waiting for the phone call from their child abroad, and like they are with the phone or talking to them on video, and certainly it impacts sleep.
Thank you. And as you pointed out, like letting go of the device before you sleep has become the most difficult task these days. So tell
Absolutely.
us a little.
It's not only just before sleep, like unfortunately, it is right by the side of the bed, and there are people who wake up and still look at it, whether it is for messages or for, you know, how many likes they have got or any of those matters, and it certainly keeps your brain busy and affects your sleep quality.
There is a lot of information online, doctor, about how many hours you actually need. So how many hours do you need as a child, as a teenager, and as a full grown adult? And nobody seems to be able to fully agree on what the right duration is. Tell us about that.
Sure. I mean, there is something called ideal, there's something called practical. So I would just say that, a lot of the times when you look in the textbook or, like the media or whatever is available online, like several times we see that the ideal amount of sleep time is what is mentioned, which we should know because our sleep time has been shrinking and we have been trying to accommodate to a lesser amount of sleep. So to start with, if I may say, a newborn would sleep about 18 to 20 hours in a day. Most of the day the child, the newborn spends sleeping, and all it does is probably other than that feeding and nothing else. Like no specific activity. As the child grows, somewhere close to what we call the school going age, somewhere around 4 to 5, the child consolidates the sleep primarily at night. And the child can sleep about 9 to 10 hours in the night, and given a chance, the child can also sleep an hour or so in the afternoon, like a nap. Okay, those good old days in my kindergarten days, we used to be allowed to nap in the afternoon, no longer. And so certainly that's how the pattern changes. As the child grows further, particularly in the adolescent age group, and by adolescence I mean, like the high school children, or for that matter, the first year of college or any of those adolescents, ideally require about 8 to 9 hours. But if you can find one of them in this city who sleeps 8 to 9 hours, please bring them to me because with all the additional pressure that they have, the number of exams that they have to take, the peer pressure that they have, the additional classes that they have to attend, most children, most adolescents don't get it. But we tell them that try to get at least 7 to 8 hours. So this is where you would find a difference between being ideal and being a little practical. um, and you tell them you get 7 to 8 hours, but more importantly, I always tell them try to get that consolidated together. Okay, what happens is a lot of the children, between classes, they'll nap for half an hour, 1 hour. On a day, they may still get about 6 hours or 7 hours, but it is so fragmented that it really does not make them feel fresh or make them productive. Adults typically require anywhere from 6 to 8 hours of sleep is what is ideal for them. And older adults also require similar amount of sleep, although the sleep pattern starts changing, particularly post retirement. When people are at home, they may have an afternoon nap or sleep for an hour or so, and therefore that reduces their sleep time in the night, but they still require about 6 to 8 hours of sleep. I also wanted to close with an interesting trivia that women require 20 minutes more sleep than men, and again, most women probably don't get it.
Definitely not, doctor. That's true. Tell us a little bit about what happens when you're working night shifts. A lot of jobs that we see these days involve starting work late in the evening or sometimes in the night and end up going all the way till the morning. Does this affect your circadian rhythm?
Absolutely, yes. I mean, the commonest example we can quote for circadian rhythm problem is jet lag. When you're traveling from one country to another where the time zone is different, obviously, when you're landing, your body is not in sync with the time where you're landing, and therefore, you may have trouble sleeping. A lot of other things go with it. So, jet lag is the commonest circadian rhythm disturbance that we think about. The examples that you quoted, the shift workers who are working, like afternoons, late afternoons, or night, are chronically jet lagged. That's exactly what that is happening because, to quote an example, normally when I am in the evening or night, when I'm eating dinner, which is supposed to be light. On the other hand, somebody who's working a night shift is actually going to eat something that's like a breakfast for them because they're getting ready to go to work. So they may have to eat a heavier breakfast. Uh, Once they go to work, imagine outside the environment is telling you to sleep because it is dark outside. But then you are having light in front of you, whether it is a computer or like you're working with machines or any of those. Then like your outside environment wants you to sleep, but you are trying to stay awake and you're fighting it. Okay, and during the night the rest of the world is sleeping, whereas you may have to have a lunch which is light. Okay, because you are working for 8 hours or 9 hours or whatever. And in the morning when you come back home, the outside environment is telling you to stay awake because there is sunlight almost like 7 o'clock or whenever you return. But your body is so exhausted and is ready to sleep. And when you come home, everybody is eating breakfast, which could be heavy, but you have to have a dinner because you are now getting ready to sleep. And therefore, like you need to eat light and go to bed. Now comes the most important part. When you go to bed in that daytime, outside it is bright and sunny, and therefore it's important to make your room dark, make your room conducive, and most important thing, not have a cell phone next to you because the rest of the world is awake and active, and you are trying to sleep, and they don't know you're sleeping and they're going to be calling. So preferably avoid the phone in the room, keep it outside, and also tell your affectionate mother not to wake you up for lunch because when the rest of the world sleeps, they don't wake up and eat. So if you're sleeping in the afternoon, Your sleep needs to be continuous, and you need to have that uninterrupted sleep so that you wake up and get ready for work. So I want to summarize by saying that our body has an internal clock, and it's influenced by the external clock, particularly the light. Uh, and therefore, it's important to be in sync. And if we are not, if we have a job, like as a doctor, I work night shifts at times. So if your job requires that, learn to cope with it appropriately. Do these simple things on adjusting, and therefore you can be healthy and sleep better. If not, we're seeing a lot of problems, health problems among shift workers. Um, I told you earlier that during sleep, our hormonal cycles are very important. In shift workers, we are beginning to see particularly young women with a lot of menstrual irregularities, men and women with very high infertility rates. Like all of these seem to be impacted by their shift work times. And of course, as I've already told you, since the sleep is affected, they are at higher risk for high blood pressure, diabetes, heart disease, and stroke, what we refer to as the non communicable diseases.
Thank you so much for speaking to us today, Dr. Ramakrishnan.
Thank you so much.
Thank you.
Yeah, thank you so much for that, Zubeda. We should wind up with our fun fact. So we did speak about sleep care earlier during the session. So I thought it's good to have weird fact that arises out of sleep.
Sure, can't wait to hear it.
So your brain is actually more active when you sleep than when you're awake. Did you know that?
Wow.
Yeah. It just means that, I mean, it's counterintuitive if you think about it, but then the brain never gets to sleep. So it's always active processing. But when you're sleeping, apparently the regions associated with learning, memory, and emotional processing are active. And so the brain is trying to sort these things out for you so that tomorrow can be a brighter day. So that's a wrap. Do remember to tune in to the Health Wrap by the Hindu every second and fourth Friday. Thank you.
Thank you.